Good evening, class. My name is Joy Moses, and today I'll be talking to you about infant mortality rates. Did you know that every year in the U.S., 28,000 babies die before their first birthday? Based on my research from the Center for Disease Control and the Department of Vital Statistics, the U.S. is leading by being ahead of 28 other countries such as Hungary, Mexico, Singapore, Taiwan, and infant mortality rates. This is very disturbing to me because I believe we live in the best country in the world. We live in a modernized civilization. We're not a less developed country. We might not have socialized medicine like Canada does, where everybody gets health care for free. But although it's not free, I do believe it is accessible. Upon doing my research, I discovered that places like Mississippi and Alabama had a death rate for infants of 7 out of 1,000 versus places like Washington State and Massachusetts who only had 5 per 1,000. This, like I said, is very disturbing to me. Where are we? Are we not in the United States of America? How is it that we have all these technological advances in medicine, all these things at a time that I believe is the best time to live in? I mean, we have computers. We are so technologically advanced that, case in point, when I was stationed overseas on a deployment, I couldn't tell my family exactly when I was coming home for security reasons. So when I got to Hungary, one of the countries that's doing better than the United States as far as infant mortality rates, I was stationed in Alaska, but I was in Hungary at the time. I started my car with a remote starter from Hungary in Alaska. I was able to start my car over the phone to let my family know when I would be home, yet we have higher infant mortality rates than places like Hungary. That is very alarming to me, so much so that it brings me back to a time where I first learned about infant mortality rates, and that was in 2007 when I pledged the best sorority in the world, Zeta Phi Beta. And Zeta Phi Beta has collaborated with one of the leading advocates for infant mortality, which is the March of Dimes. Zeta Phi Beta launched a program called the Stork's Nest, and it was established in 1972. And what it does is it gives mothers of any ethnicity the opportunity to have incentives like baby clothes, low or reduced health care. Prenatal care was one of the leading causes of infant mortality rates because prenatal care wasn't achieved in the first trimester. That in turn led to preterm delivery, which is the leading cause of immortality. That was one of the biggest determining factors in a baby's first year of life. Premature babies have a very small chance of surviving after the first year. So what the Stork Nest does is it provides support, emotional support, it provides educational support for, like I said, mothers of all ethnicities, but we try to reach out to mothers who have limited access to health care. So with African Americans being 4 times as likely to die before their first birthday, we kind of try to reach out to them especially. So I'm of the persuasion that, okay, people say, well, what can we do? What can I do? How can I help? I'm of the persuasion that when there are incentives involved, people are more inclined to do things. So I did some research and I found out that big corporations like American Airlines, IBM, Macintosh, they offer incentives through the March of Dimes for people who are willing to walk, and they make it into kind of a competition. Whoever walks the most or whoever raises the most money, they'll give you a buddy pass, or there's some incentive involved. So please feel free to research. But I walk and I've been walking since I pledged Zeta Phi Beta since 2007, and I walk to promote healthy babies, healthy moms, and for all the babies who won't be born healthy, I walk so that one day they will become healthy. So please, whatever you can do, find out more about the organization, find out what they do, why this is important to our community. All babies are important, but it's alarming to me that African American babies, Hispanic babies, and Alaskan babies have a high mortality rate, and that's disturbing. We all live in the United States of America where health care is accessible, so we should all be given the same right to life. And that's all I have. Have a good evening.